speak about digitization, one of the things is that because there are so many service providers feeding into it, it is getting harder and harder to figure out where all the data resides from end to end, from when the patient gets enrolled to all the way when they get treated. There's inputs that you need to track on all of that that become part of the audit trail of what has happened to that patient. So if something goes wrong, where did it go wrong? How did it go wrong? How do you fix? The regulatory agencies want to see that for safety's sake, to demonstrate control of the product. So the more inputs you have doing different parts, the more there's data coming in and out in different places, and the more complicated it becomes to have a single source of truth for that single patient across, from the donation of the cells all the way out to the being treated. So the digitization now has to deal with not just the little parts, and there's a lot of people playing on the little parts, but how do you connect all of those parts so that all of that information is in a usable form? And then you also want to have that information for how do you process improve, how do you increase safety, how do you make your next product better, what indications might be able to happen, how do you control the process better, how do you tech transfer, so that all of that data comes together in a way so you make better decisions. But it isn't just one company having all of that data in one place. That different suppliers of different services are supplying all that data. So it becomes complex the more players are in it. So you're solving one level of complexity, which is the companies now don't have to do every one of those steps, which is, the first CAR Ts, the companies had to do everything. They had to be great shippers, they had to be great cold storage people, great manufacturers, great patient services. Now all kinds of companies are coming in to fill each of those spots, but now you got to bring the data all together. So you don't have to do the work, but you have to make sure the work is done right and that you're tracking across all the patients. So digitization has to account for all of that complexity and draw all the information together and be usable, and the right data has to be available to the right person in that chain, and respect privacy, respect all those rules, respect borders, geographies, because you can't move certain patient data across borders and all of that. So you have to take into account quite a lot of stuff for the digitization to actually work and for the data to actually be usable.